Well, the number of HIV cases in the general population has slowly declined over the last 10 years, but has increased slightly in men ages 13 to 29.
More people will have access to a powerful tool for HIV prevention thanks to an initiative from UW Health's HIV/AIDS Comprehensive Care Program. It's called PrEP It Up. Dr. James Sossman is the medical director of the program, and Shannon Ruth Lee is a PrEP navigator. Welcome to both of you. Good to see you.
Thank you.
So, Dr. Sossman, what does PrEP stand for?
It really stands for pre-exposure prophylaxis, which is really the role of using a medication called Truvada, which is one of two medicines that are available that has anti-HIV medicines in it, taken once a day to prevent someone without HIV from getting HIV.
So who are we targeting? What's the market here? What's the group?
You know, we're targeting people that are sexually active, that may be in a committed or uncommitted relationship, and that kind of have a risk for potentially acquiring HIV.
So the safe sex is not required with this, or is it encouraged as well?
We certainly would encourage safe sexual practices, but a lot of individuals do that, or they may not do that all the time, and this is really helpful for that.
Shannon, what is a PrEP navigator?
So a PrEP navigator is somebody who can help folks access PrEP. Healthcare is really complicated for everybody, and so it's my job as a PrEP navigator to help folks understand their insurance, access financial assistance to pay for care, and just make sure they can find a doctor to get PrEP.
Does insurance cover this drug?
Yeah, Badger Care and most private insurance plans do cover.
It's pricey.
It is. It's an expensive drug, but it's a common misconception that cost is the major barrier. We can actually make it accessible and affordable if you come work with a PrEP navigator.
Even if you don't have insurance, private insurance.
Even if you don't have insurance, there are assistance programs out there.
So how will this initiative make a difference?
Our hope is that by spreading the word in this major way, we're going to get the awareness up of PrEP. That's also a huge barrier that folks just don't know about it. So with PrEPItup.org and the advertisements that you'll see around town, we want folks to know PrEP is out there and it's accessible if you get in touch.
Doctors, is it alarming that the rate is going up for young people?
Yeah, it is. You know, we did make some improvement in the last 15 years. We had been at that time about 55,000 new HIV cases in the U.S. every year. Now we're down to about 39,000. But that rate has been sitting there and pretty plateaued. So we're really trying to increase this initiative. We think in PrEP alone, and there are other ways to also prevent HIV, but we think it's very effective. We think of the people that would be eligible, maybe have some risky encounters or whatnot, we think only 10%, less than 10% are on it. And we think well over 1 million people in the U.S. would be eligible for PrEP.
And you have to take this every day. It's not, okay, I'm going to go out tonight. I mean, it's a pill you have to take every day.
Yeah, the guidance is to take it every day. It's most effective when you take it every day.
And if you take it, it will prevent you from getting HIV? Am I understanding that correctly?
And people, you know, studies have been very compelling. When people take it regularly, it can reduce their risk by about 99%.
Wow.
But it doesn't prevent other STDs.
It does not.
So that's what
we are seeing a surge in that for many factors.
All right, so if people want more information, they can contact the UW Health?
Actually, go to PrEPItup.org, and you'll be able to get medically accurate info and reach out to us.
Keep up your great work.
Yep.
Great to
Thank
see
you.
both of you.
Thank you.
Exciting.